Good morning, ladies and gentlemen. Today we'll be talking about cough in children. So many persons have asked for this topic because they keep asking, doctor, my child has cough. Which cough syrup should I give? My child has cough. Which cough syrup will I give? Doctor, prescribe cough syrup for me. I said, relax, relax. What is wrong with your child? We must establish a diagnosis first before we know if we will give your child cough syrup or not. Now, what is cough? Cough is simply a protective mechanism. It protects your child from getting a very serious respiratory problems. For example, when there is foreign body in the respiratory tract, you cough so that you bring out whatsoever the foreign body is. If it is bacteria that is irritating the respiratory system, the cough mechanism comes into play to see if it can do what, expel the whatsoever is causing the attack, whatsoever is causing the problem, whatsoever toxins this bacteria is producing to cause cough. It tries as much as possible to do what, to expel it. So cough is actually a protective mechanism. When your child is coughing, it means that something is what, triggering that cough. The cough does not just come on its own. It is a symptom of something is going on. So when your child has cough, the first thing you need to do is to what? They will need to evaluate that child to be sure what is causing the cough. Could it be foreign body? Sometimes your child will have foreign body, he will just be coughing. You will just think, why is this child coughing? For over 2 weeks my child is coughing. I've been giving this child cough syrup. The cough syrup is not working. My child keeps coughing. It could be bacterial infection, lower respiratory tract infection, pneumonia. Your child is just coughing. You continue to give cough syrup. The cough syrup is not working. For over 2 weeks this child continues to cough. Come on. You continue to give your child cough syrup for 2 weeks, for 1 week, and the cough is not resolving, and nothing tells you that this is not just ordinary cough. So what you need to establish first is to find out what is causing this cough. Could it be foreign body? Could it be bacteria? Could it be viral infection? These three things, you must rule them out. So what is the commonest cause of cough in our environment? Most time it is even viral infection, and this is the reason why your cough syrup even work for you, because it could be that the cause of the cough in your children is what, a viral infection. Viral infection resolve on their own. They resolve on their own. The reason why you give cough is so that the child can sleep well, so that the child will not be having difficulty in difficulties. Cough is quite embarrassing, so you want to reduce the cough by giving them what, cough syrup. This is if it is a virus that is causing the cough. Now sometimes your child could be coughing, it brings out phlegm, yellowish phlegm, smelling phlegm. When it cough, it smells. Something will tell you this cough, this thing that comes out, this is not abnormal. This is classically chest infection. It could be bacterial infection. This is classically chest infection. If you continue to give cough syrup in this situation, the cough will relieve him, but what will happen is what? The child will continue to have destruction of his lungs. You understand? The child will continue to have destruction of his lungs. If it is pneumonia that is causing, you keep pumping this child with cough syrup, what will happen? The child will eventually develop long-term lung fibrosis. The lungs is getting destroyed. If it is tuberculosis, for example, your child keep coughing for 3 weeks, you keep giving him cough syrup, don't knowing that what is causing this cough syrup is what? Even tuberculosis. What is happening is it will infect you, infect everybody in that house, and the lungs will continue to be destroyed. So when next your child has cough, it is not something you need to joke about. Most persons, they just think it's just not just cough, na cough and catarrh. No, don't ever take any illness as just simple, not just common. No, no sickness, no illness is just common. Most illness that you feel that they are common, they are even the one that will knock the person. No, it's just common cough and catarrh. What don't that common cough and catarrh is a foreign body that is inside that child's respiratory tract. What will you do? You keep treating cough. Keep you some person when they will bring their medication containers. You see all different type of cough syrup in it. Yeah, the cough has not resolved. So what you do first is what? Take that child to the doctor or to a nearest a not quack nurse, maybe a pediatric nurse or a nurse that has gone to nursing school. She can at least elicit signs of pneumonia. If a nurse that is well trained sees signs of pneumonia, she knows there are classical signs. You know that this is pneumonia. The nurse will know that this is pneumonia. What will she do? She will refer you to what? To a doctor, or she will place that child on some antibacterial that will help that child until you eventually get to a doctor. This is in a locality where you don't have hospital, where their primary health care is not working effectively. So this is one of the causes of cough. If it is viral that is causing this cough, for example, if it is pneumonia, if it is let's say there are a lot of viruses that cause bacteria, most of them will resolve on their own. So you really don't need antibiotics for this. But how will you know that this is a viral infection that is causing this cough? This is not a bacterial infection. First and foremost, the sputum, when the child cough, when it brings out the sputum, does it smell? Does it have a bad smell? What is the color? How does it look like? Is it bloody? You understand? All these things will give you an insight that this is what this is a bacterial infection that is causing this cough, or this is viral infection that is causing this cough. And another thing is, one of the quickest way to be sure that this is bacterial infection that is causing this cough is to do what? A full blood count. Complete blood count must be done. Once it is done, you just look at it. WBC highly elevated. This is what? Most likely bacterial infection that is causing this cough, and I swear this child will start running fever. So the cough syrup you give to this child, the paracetamol you give to this child, they will relieve the symptom. For one, if I'm treating a child for pneumonia, I don't give paracetamol. At least the first day, second day, I don't give paracetamol. I rather tap his point. The reason why I don't do this, the temperature, the fever in this child will give me a sign if I'm winning or not. If I give paracetamol, the paracetamol will mask the fever and I will not know if I'm winning or not. So I will not give even paracetamol. Rather, I'll be tempest punching this child while I continue the right dose of antibiotics. Once I've continued this and I see that the temperature is dropping, stepwise dropping, then I'll know, I am winning. I'll be happy I am winning. You understand? So cough is not something that you need to joke with in children. It could be something that you want to cause serious destruction in children. Cough, I do look at it as a thief in the night that just come that want to steal. So it could just be that it is a sign that something more mysterious is about to happen. You understand? So don't ever take cough for granted. Once you have a child, you are giving cough syrup 3-4 days, the cough is becoming worsening. That thing is not just ordinary cough. Take that child to the hospital. Let them rule out other causes of cough. It could even be asthma. There was one child that came to the hospital one certain time. The father, I keep giving cough syrup. This child is not getting well. I keep giving cough syrup. At the end of the day, we pick the stethoscope. We examine the chest. Wheezing everywhere. This child has been having asthma. The parents thought it is just what? Ordinary cough that is not resolving. They placed the child on asthma medications, and before you know it, this child became better. You know. So when next you see a child that is coughing, don't just assume that your normal regular cough syrup will help you. It may not help you. Take that child to the hospital. They will examine the chest. What the doctor hears in the chest will give him idea of what is going on in the chest. They will do blood test. The picture of the blood test will give him an idea of what is going on in the chest. You know, if care is not taken, they even do X-ray. The X-ray will give him signs, you know, an idea of what is going on in the chest. So just imagine you did not do all these things and you just decide to give your child cough syrup because the child is coughing. The cough will be resolved, but the main thing, the secondary thing, that is the primary thing that is causing that cough has not been dealt with. If it is viruses, you are lucky. It could resolve within some days, 1 week it will resolve. What you just need to be doing, give him paracetamol, give him cough syrup, it will resolve. But if it is bacteria that is causing this cough or foreign body, no matter how much cough syrup you give, it will not resolve. It will even cause serious more damage. You damage the lungs for that child. Thank you so much. And if you have any question, I will not hesitate to respond to your questions. I respond very fast to questions that are pediatrics. Once it is pediatric questions, or once it is questions that have to do with obstetrics questions, I respond to them with speed, because I don't know the situation that person that is asking this question is. So if you have any question relating to cough in children, please drop your questions. I will not hesitate to respond to you. Thank you so much, and have a wonderful weekend. Bye bye.